Hi guys, I'm Dr. Kuchi and today I'm here to give you detailed information about a common disease, alopecia. Alopecia is a disease that happens when our immune system attacks our hair follicles and causes hair loss. Hair follicles are a structure in our body that forms hair. Hair can be lost from any part of the body. Alopecia affects the head and face. Hair falls out in small round patches about the size of a quarter, but in some cases it could be extensive and progressive. The course varies from person to person. Some may have bouts round of alopecia, while others may have a single episode of alopecia. Recovery is unpredictable. There isn't any cure for alopecia, unfortunately, but with the help of treatment, we would be able to regrow hair quickly. Who gets alopecia? Anyone can get alopecia. Men and women equally affects in all racial and ethnic groups. Usually it happens in age of 20 and 30s, but if it may happen in age 10, then it tends to be more extensive and progressive. Number 2, genetics. People who has a history of alopecia are at a higher risk of alopecia. Number 3, people with autoimmune diseases like psoriasis, thyroid, or vitiligo are at higher chances of getting alopecia. And number 4 is stress. Many believe that stress triggers alopecia, but there isn't any scientific evidence that stress really triggers alopecia. So types of alopecia. There are 3 types of alopecia. Number 1 is patchy alopecia. What is patchy alopecia? This is the most common hair loss, may happen in one or more coin-sized patches on the scalp or other part of the body. Number 2 is alopecia totalis. People with this type lose all or nearly all of the hair on their scalps. Number 3 is alopecia universalis. It is rare. There is a complete or nearly to complete loss of hair on face, scalp, or rest of the body. How to figure out alopecia or symptoms of alopecia. It affects hair, but in some cases there are a change in our nails too. People with alopecia are usually healthy and have no other symptoms. Number 1, hair change. Alopecia begins with the sudden loss of hair, loss of round or oval patches of hair on the scalp or any part of our body. It affects beard in men, eyebrows or eyelashes too. Around the patches there are often short broken hairs or exclamation point of hairs or narrower at their base than their tips. Tingling, burning, and itching sensation felt before hair falls. It's very difficult to predict what happens next. The hair regrows within few months, or it may look white or gray, but at first, with the passage of time, it may get back to its original color. Smaller patches are joined to form a larger one. The hair may regrow, but there is a possibility of subsequent episode of hair loss. It regrows on its own more fully and less extensive. Later age of onset, no nail change, no family history. Causes of alopecia. There are 2 reasons or causes of alopecia. Number 1 is genetics, which I have already mentioned or explained, that people with the family history of alopecia or any autoimmune diseases or at a higher risk of getting alopecia. And number 2 is environmental factors or non-genetics factors. And number 3, which I have said that stress may trigger alopecia. I mean to say, many believes that stress triggers alopecia, but honestly, there isn't any specific or evidence or proven evidence that stress really trigger or play a role or an important role in getting alopecia. Treatment of alopecia. Treatment includes treating the underlying causes and providing supportive care. Treatment may address any underlying conditions and includes topical scalp medications. Medications may include steroids, vasodilators, anti-inflammatory and immune suppressive drugs, and self-care with SPOVA and stress management.